We begin, though, with the growing push to mandate COVID vaccines in the workplace as the Delta variant rapidly spreads nationwide.
Yeah, tech giants Google and Facebook are now some of the largest employers telling workers they must be vaccinated if they want to return to the office. This comes on the heels of a major announcement expected from President Biden today. The message to all civilian federal employees: get your COVID vaccination or prepare for regular testing and masking rules. And the topic of masks still creating a lot of confusion and debate following the CDC's new guidance, especially on how it impacts vaccinated people. While some states are considering the new guidance, others are refusing another mandate.
We have a team covering everything you need to know this morning about the current rise in cases and the debate over masks and the vaccine. Let's begin with NBC News correspondent Carrie Sanders in Orlando, Florida. Carrie, good morning. So one of Orlando's biggest tourist spots, of course, Disney World. You think Orlando, a lot of times you think Disney World or Universal. Disney World is now changing its mask rules. What are they doing, and are other theme parks changing their rules as well?
Well, this is really reflective of what they have seen at the largest healthcare system here in Central Florida, Advent Health, which is where I am. They've seen increasing numbers of people at dramatic levels of folks who are testing positive for coronavirus. So as you just noted, Disney World now has decided that they are proactively going to change their mask policy, and they gave us a statement. I'll just read it to you as we take a look at the video of Disney World here, that Disney will require cast members and guests age 2 and up to wear face coverings in all indoor locations of Walt Disney World Resort and Disneyland Resort, that's California, beginning Friday 30th, regardless of vaccine status. And of course, that's important because there has been a general sense that those that are vaccinated don't have to do this. Those that aren't vaccinated do. But the honor system does not apparently work as well as they'd hoped. Let's take a look at the statistics here that are reflective of just Orange County. And of course, Disney World is partially in Orange County. And this is what they have seen in terms of just one day number of coronavirus cases. It is 1,371 cases on just Tuesday. And to understand that, in June, they had a 3.7% positivity rate, and now it's at 15.58. It's why the it's the Orange County mayor called for a state of emergency. He says this is indeed a crisis, Savannah.
All right, so that was in Orange County. Now let's broaden out to the whole state. Florida Governor Ron DeSantis has banned local leaders, though, from enacting a mask mandate. Some counties, as we're talking about here, are still taking action. So what's happening there in that broader sense across the state, first in Orlando, but then also just as these local leaders have to try to make decisions, given that that's the guidance coming from their governor?
Well, you know, the governor and the state legislature took away the authority of local governments to respond in their local communities with things like mask mandates. In fact, we saw in Broward County earlier this year, those who had been fined were given a pass by the governor and said, you don't have to pay those fines. And so it's left the local governments, according to, for instance, the Orange County mayor, a sense of being powerless. And so they can get out there like cheerleaders and sort of encourage people to do things like wear masks if you're indoors, but not require it. This is what the Orange County mayor, Jerry Demings, had to say.
We want our residents, businesses, and visitors to follow the updated CDC guidelines to make sure there won't be another shutdown like we experienced last year.
And so the governor there, the Orange County mayor there, talking about the fact that he does not have the authority because it was taken away by the governor. Savannah?
So how is the governor reacting to this new CDC guidance? I mean, it's that where there is a high transmissible rate of COVID, you should be masking up. You're telling us these high case numbers. What's his response to this new CDC guidance?
Well, when you look at the numbers right there for the state of Florida, I mean, they're eye-popping. Early in this process of what has been a pandemic that we have all gone through in a roller coaster, if you compared Florida to California, and they had two very different approaches in terms of masking, the numbers were about the same. And so if there was the battle, the governor's response was one that seemed to be to residents in Florida to be the appropriate response, because the masking mandates were not as strict and the indoor lockdowns were nothing like California. But now you can see the battle may have been won then, but now the war, very different case when you see how the numbers have climbed, as we said, more than 15% positivity rate. The governor telling West TV, the NBC station here, in part, when you say to someone you've got to wear 6 masks after you're fully vaccinated, that is not evidence-based. There is no data to support it, but it does send a message to people who may be more hesitant to get the vaccine to say, what the heck? If it's not working, why would I get it? And so that's where we find ourselves with the vaccine drive. And so what the governor is saying is that there is confusion by forcing people to wear masks. We'll see how this plays out. But if we look at the wastewater treatment plants, which in many parts of the country, they monitor what's in the wastewater treatment plants, and they're able to see the RNA that suggests where things are going. And it's been a very accurate predictor. And the graph goes like this right now, which means in about 7 days, if everything follows as it has before, the data will predict that we will see a huge increase in the next week here in Orange County of people coming down with coronavirus. Savannah?
And Governor DeSantis, they're getting at both the confusion and also the concern. Does this make people not want to go get the shot if it means they still have to wear a mask, which we will get into with the doctor momentarily. Carrie, good to see you. Thanks for your reporting.
All right, now to President Biden's expected announcement later this morning on a vaccine requirement for federal workers. NBC News White House correspondent Monica Alba is here now. And Monica, what are you learning about the president's announcement today, and just how many employees are we talking about?
This had been in the works for a couple of weeks, Vicky. The White House was looking at this, and it will apply, we understand, to millions of federal workers. And the way the president is going to announce this in these remarks later this afternoon is to say, essentially, this is not a mandate. This is something the White House has been very careful about language-wise, because remember, just about a month or so ago, the president said the virus was in retreat, trying to declare our independence from it on the 4th of July. So this is something where the White House is saying they're not going to go back to the previous lockdowns or mandates that we saw. Instead, they're going to ask federal workers to have proof of vaccination or then be willing to submit themselves to regular testing, something we've seen a lot of states do. For instance, New York, where you guys are, that's what they're already doing for 300,000 federal employees. And that's going to start likely in September. So still giving those federal workers and, of course, state ones time to get vaccinated. And that's really the urgent message that you're going to hear from the president today.
So there is a choice here. It's get the jab or get a swab, right? So what about employees who don't want to get the vaccine? Do they have an alternative other than this frequent testing? And how often will they need to be tested?
And that's what we don't know yet. And different agencies may have different rules. So, for instance, the White House is going to make these recommendations, and they're going to say, we would like all of the department heads to essentially come back to us with their plans. But the requirement overall is one or the other, either be vaccinated or be willing to either do weekly testing or whatever they determine is best, because it is these breakthrough cases that have been such a cause for concern. As we know, guys, here just on the campus itself at the White House, they've seen examples of them, even though they've still declined to give us exact numbers of how many White House officials have tested positive after being fully vaccinated.
And we've talked to public health officials who say they think the number of breakthrough infections is much higher than we actually even know. So, Monica, we know the military has also been struggling to vaccinate more of its service members. The president has the power to require the military to get vaccinated, but that seems unlikely given what you're saying, that he does not want to issue a mandate. Do we know what percentage of our service members have already gotten the shot?
About 73% have gotten their first dose, Vicky, and about somewhere in the 60% range are fully vaccinated, which is higher than the national statistics. We know only about 50% of Americans are currently fully vaccinated, and the White House missed its goal of having 70% of all adults with one dose by the 4th of July. In fact, they're still not there. In terms of making this mandatory for the military, the other roadblock there is that, remember, these vaccines are still under emergency use authorization. If that were to change, then there's a possibility, but the White House will likely defer to the defense secretary and have him make that request before making it official.
Big announcement coming. Thanks for breaking it down for us, Monica.
Let's now bring in NBC News medical contributor Dr. Kavita Patel. Dr. Patel, always great to have you. So let's get into these vaccine mandates. Of course, this one that we were just discussing, we're expecting from the president. New York State just announced a similar thing, requiring state employees to either get the vaccine or undergo weekly testing. Let's talk through the impact that these mandates have sort of overall. I'm not sure if the goal here is that enough people comply based on these mandates that it really makes a dent here, or if it's to make each individual workplace safer. But what do you make of these?
Yeah, good morning, Savannah and Vicki. You're right. This is a pretty uncharted territory for adults. But keep in mind, for most healthcare workers and children, we've had a lot of vaccine requirements for decades. So here's what it means. It means that employees will have confidence in returning to the workplace. I think you're seeing that the recent CDC guidance has shaken not just consumer confidence, but it's made people wonder, is my workplace safe? Is my school safe, et cetera? This mandate or series of mandates, private and public, I think allow for people to have that sense of normalcy so that they can go mask free in workplaces. I think it'll be a real signal that we're returning to normal if we can do it.
Absolutely. So let's dig into some of the mask issue, and I'm going to ask you what we were just talking about with Carrie in a second. But first, let's start with this idea that it's a pandemic of the unvaccinated and what that's essentially doing to vaccinated people. Some are feeling anger towards the unvaccinated. I want to read this to you. One woman told NBC News, "Now I'm getting to the place where I'm angry that I see other people not doing the same, not getting vaccinated when they can. Don't we all want to get back to normal?" You just mentioned, of course, getting this shot is a way to get back to normal. It's a step in the right direction. How do you address these concerns of vaccinated people who are kind of wondering, hey, I got the shot. What was the point of that? And how do they help reach unvaccinated people?
Yeah, it's something I'm seeing personally and professionally as well, Savannah. So number one, you have to keep in mind these vaccines, and all the data supports it, are still incredibly effective at preventing what's happening in the pandemic of the unvaccinated. We're seeing the hospitals overflowing. I'm watching people stay in the ICU a lot longer, Savannah, than we would even expect, which is a bad signal about how dangerous this Delta variant is. Number two, if you are angry, think about it this way. It's actually not just for the people who, quote unquote, are anti-vaxxers. There's a large population that is incredibly heterogeneous, some of whom we've actually let down, people of color, who we really let down in this pandemic in the first place. So when you think about get the vaccine for yourself, you're protecting your neighborhood, your family, your community. But then when you're also having to wear a mask, you're doing the same for an unvaccinated child, for someone who's got a compromised condition. Those people don't have labels on them. So think about it as just one step to keep your community safe. The third is tell people, instead of being angry, find that person you know, all of us do, who refuses or is concerned about getting vaccinated. Focus not on blaming them, focus on sitting down with them and saying, you're important to me. I want you to do this for me, and making it a little more personal. I hope we can get past the anger that way.
That is great advice. Dr. Patel, quickly before I let you go, I just got to ask you on this mask topic. What's your message to people who are now maybe questioning the effectiveness of the vaccine if they see those people who got a shot still need to wear a mask? I thought that was the point.
Yeah, that's first of all, the point really was it saves your life. It prevents you from going into the hospital. Thinking about wearing a mask just tells us that this is a pandemic that we have not gotten behind us. I have to remind people, January of 2020, Savannah, we had one man that was hospitalized in Washington state with this. And look where we are now. We can beat this back. Wearing a mask is a symbol of doing that. Think of it as your suit of armor, with your vaccine being your internal protection, your mask being your external one.
Dr. Kavita Patel, always breaking it down in the best way. Thank you so much. Good to see you.
Now to a big deal on Capitol Hill. Lawmakers are one step closer this morning to passing a $550 billion infrastructure package. After more than a month of negotiations, the Senate yesterday voted 67-32 to begin debate on the measure. That includes 17 Republicans for the bill.
The Senate has just come together and in a strong bipartisan fashion voted to begin the legislative process here on the Senate floor.
We've still got a long ways to go before we get to the finish line, but this was a vitally important first step.
NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Leanne, Democrats are also trying to pass a separate party line measure for human infrastructure. What can you tell us about that so-called reconciliation bill?
Good morning, Vicki. That's right. As there's a lot of excitement about agreement on this bipartisan infrastructure bill, many Democrats are demanding movement very soon on this $3.5 trillion human infrastructure bill. And one key component in that is a major expansion of home-based health care for the elderly.
Hey, let me buckle you in, though, okay?
90-year-old Ray Newbaker struggles with dementia and a broken hip. Her children, Paula and Jay, are her round-the-clock caregivers.
Do you like your home? Oh, yes. I love it here.
But it's not easy, taking care of her personal needs, managing her finances and doctor's visits, along with her worsening dementia. It's emotionally, physically, and financially exhausting.
Is this hard on you? It's the hardest thing I've ever done in my entire life.
A growing number of aging Americans would prefer to stay at home. Because Medicare doesn't provide for long-term home health care, and Medicaid assists mostly low-income patients, and waivers often come with long wait lists. In their twilight years, many fall through the cracks.
I call it the twilight zone, where we make too much for Medicaid, and yet we don't make enough where we can afford 24/7 high-quality care for my mother. So we're stuck, paying for her care out of our own pocket. And while we're more than happy that we're able to do it, it's really not sustainable.
In the Democrats' human infrastructure bill, they want to increase the number of people eligible to receive home-based care through Medicaid by raising the income cap to 3 times the poverty level, or an income of about $38,000 per year. It would provide financial help to an estimated 3.2 million elderly and disabled.
Many people in this country are going to spend down their entire life savings caring for parents, caring for children. We can do better than that. We know how fundamental this is, and we have to stop relying on our safety net being the low-paid or unpaid work of women.
40 million home health care workers are some of the lowest paid in the country. Jody has been taking care of the elderly for 25 years.
There's people out there that are working at McDonald's that are making more money than me, and that's really not fair.
Have you ever thought about leaving this job because of the wage?
Absolutely.
Along with aiding the elderly, Democrats' proposal would help people like Jody, too, by requiring they're paid a living wage. The 2 parts of the proposal come with a high price tag, up to $300 billion.
And people say it's expensive, and I'd say, yep, it is expensive. It's about time we started to invest in families.
Democrats are confident that their proposal is popular. Internal polling obtained by NBC News found that likely Democratic voters are very supportive of expanding home-based elderly care and increasing wages for those workers. As for Republicans, well, Republican senators tell me that they might be open to having a conversation about expanding home-based care for the elderly, but they are adamantly opposed in including it in this major package. They call it a reckless tax and spending spree, Vicki.
Yeah, they got to find the money. It is a lot of money, but when you compare the wages of an elder care worker to that of a fast food worker, it just really puts things in perspective. Leanne, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.